New data from the Office of National Statistics suggests that 1.1 million people in the UK reported experiencing long COVID symptoms in the month up to March the 6th. The survey, based on self-reporting, looks at the prevalence of long COVID symptoms in the population. Let's talk to Ben Humberstone, who is Head of Life Events Analysis at the ONS, and also Vanessa Viapori, who has long COVID. Vanessa, let me ask you first of all, what are the symptoms then?
Symptoms that I have remaining are, I've still got some mash remaining in my lungs, so very often I'm coughing up mucus and often get some palpitations in my chest and difficulty breathing. I also have a frozen shoulder. I've lost around 60 to 70% of my hearing in my right ear, and I've got some numbness in my left leg.
And when did you have COVID and how seriously did you have it?
I think it's fair to say I had it very seriously. I was put onto a ventilator. That didn't work, and on the 23rd of March last year, after my family were told that I wouldn't make it, I was then put on the ECMO machine, and that was 23rd of March last year.
Goodness me. Do you mind me asking how old you are, Vanessa? You don't have to tell me if you don't want.
I'm 43.
Wow, you look about 28. I know that's completely irrelevant, but goodness, I was just checking. And how, in terms of the impact on you a year on, how is it affecting your life still?
It's very much affecting my life. I have to take things like, walking, simple exercise very slowly, because I can get out of breath quite quickly, and then it will take me some time to recover from it and get my breath back.
Okay. Ben, let me bring in Ben for a sec, Vanessa. Ben Humberstone, hello. So tell us more about the figures today then.
Well, what we've published today is the first estimate of self-reported long COVID. That's the experience that people have actually had of long COVID rather than the diagnosis or clinical treatment. And we found that in March of this year, 1.1 million people had some form of long COVID. 700,000 of those had symptoms that had lasted for longer than 12 weeks. And then 70,000 people had symptoms that lasted more than a year. So 2/3 of those reporting self-COVID found, like Vanessa, that their day-to-day activities were limited by the symptoms that they were experiencing. So this is having a real impact on people's lives. Not everyone with long COVID was as severely ill as Vanessa, but many people, as I say, 70,000 have had symptoms for more than 12 months. When we look at other diseases, this isn't like other diseases. You're 8 times more likely to have symptoms after COVID-19 after 12 weeks than you are if you're in the general population. So it is different. The impact on people's day-to-day activities are real, and we're talking about large numbers of people.
And do you know, Ben, and perhaps you don't, I'm not sure from the analysis you've done, do you know if certain groups of people are impacted more by long COVID?
Yes, we do. We're starting to get more of a picture of the type of risk factors. So women are slightly more, prevalence is slightly greater in women than men. It tends to be in working ages. So 35 to 49 is the age group that has the highest prevalence of long COVID. So it's going, if you put that together with the impact on day-to-day activities, then it's going to have a real impact on the workforce, on colleagues. And that's why we produce these figures, is to help the NHS and others create services and make sure that they've got the right numbers of clinic places and so on.
Sure.
For Vanessa and others.
Vanessa, what kind of help or support do you get for these long COVID symptoms?
So there's an ECMO team who have a great follow-up clinic as part of Royal Brompton. That's where I was on ECMO. There is also a follow-up clinic with a post-COVID follow-up clinic with Dr. Price, who is responsible again at Royal Brompton for the COVID patients. They've been phenomenal in following up with me. In terms of my doctor, I haven't had much follow-up unless I call them with a particular ailment to then get a referral back to the hospital.
Okay. And you said the ventilator didn't work, so you went on the what machine? Tell me about that.
It's called ECMO, and it's a machine that pumps out your blood, reoxygenates it, cleans it, and then pumps it back into your body. It's basically the last option that they had to save my life. I'm very grateful that they did.
Wow. Gosh. And I wonder, because it was clearly so close for you, between life and death, how does that give you a different perspective on these long COVID symptoms?
Very much so. I think for me, every time I feel a niggle or a pain or I can't lift my arm, I remind myself it could have been a lot worse. So I try not to complain. That's not easy, but I definitely try not to complain.
Okay. Well, thank you very much for telling us all about it, Vanessa, and continued recovery, I suppose, over the next weeks and months.